We have experts joining us on the broadcast. Dr. Anita Ramesh Chand, who is a senior medical oncologist at Apollo Specialty Hospitals in Chennai, and Dr. Rajiv Jayadevan, who is the vice chairman of the research cell at IMA Kerala, and he's also the state member of the National IMA Task Force on coronavirus. Now, Mr. Rajiv Jayadevan, let me start with you. How concerning do you think this latest case being reported from Delhi is, the fourth case that we've reported from India? How alarmed do you think all of us should be?
There is no cause for alarm here. This is only an expected event about a virus that has already spread throughout the world. Right. So, in one sense, we can be assured that our doctors are detecting it and reporting it. And the key is to detect it correctly, track the source, and stop further transmission. And that's the only way we can halt this disease. So we know that since April, this disease has been spreading to multiple nations, fueled by very large super spreader events that occurred in European nations that attracted men who have sex with men from multiple nations. And these events lasted several days, and each individual, at least some of them, had multiple partners, and they all went back to their home countries. So the virus has almost like an electrical network. It has passed through an underground covert network, unseen to many countries. By the time it was picked up by public health authorities. Now we are seeing the fallout of it slowly percolating into the general population.
Right. And in fact, as you said, that most of the cases are sexually transmitted. And in fact, a recent study said that more than 90% of cases are linked to the sexual transmission mode. Now, to get more clarity, Dr. Anita Ramesh Chand, what do you think? One question that's on everybody's mind is that, is it going to be a similar outbreak like the coronavirus pandemic that we saw?
At this point of time, it is difficult to tell whether it's going to be a pandemic or it's going to be an epidemic. But yes, the global health has given a warning that it might, we don't know in what way it's going to take a turn. So just taking small things, it's a pox virus basically, and you know, we have already eradicated smallpox over here. And in the West African countries, this is very prominent. It's an orthopox virus, and it's a zoonotic disease, means basically comes from animal. You can get, as doctor had said, human to human contact. You can also even get contact with the infected material of the pox. So that can be highly infectious. So those people who are having the pox should be isolated. And like the corona, we have to have strict isolation in the beddings, the tissues, the secretions, all are highly infectious. So if we do not get things in position, then it may go without our control, and then it may break from an epidemic to an endemic and epidemic, what we saw in the coronavirus thing.
Right, of course, Doctor, those precautions really mandatory before it gets out of control, as you say. Now, Dr. Professor Retired Colonel Manoj Datta is also joining us on the phone line. He's the medical director of Park Metro Hospital in Gurgaon. Dr. Datta, your first take, and also considering that this case that has been reported from Delhi, the man actually had no foreign travel history, but the earlier three cases had a travel history of the United Arab Emirates. So does that fact make it any more concerning?
Yeah. As you're aware that this disease now has been declared as a international emergency of public health concern by the WHO, it shows that besides the previous three cases which had come from abroad, mostly from the United Arab Emirates, this case had just a history of travel to Himachal Pradesh a few weeks back.
Right.
And he came with 2 weeks history of fever and a rash, and is now admitted in Loknayak Hospital. It shows that there is some endemic transmission also. That means inherently also that the disease may have spread through patients who might have come earlier and may have spread the disease to other contacts, which makes the importance of contact tracing. That is, we need to find the patient who were the contacts of the patients in the last 21 days. This contact tracing becomes very important.
Right.
And knowing who were the members who were exposed to this particular patient in the last 21 days, because they are capable of cascading, like cascading the illness from one to the other. And the earlier they get tested and the earlier they get vaccinated, that would be the goal towards the elimination of this disease.
Right.
The disease, as you are aware, it doesn't have much of fatality.
Yeah.
It's a self-limited disease which lasts around 2 to 4 weeks. And the main source through which it comes is through broken skin, through the respiratory tract and the mucous membranes, the eye, nose, and the mouth. So contaminated linen, contaminated beds, clothes, they need to be taken care of.
Right, Doctor, very interesting that you point out that it could be an endemic transmission, and that means we need to start contact tracing more. In fact, I was going to come to that next, that does the government strategy on this needs to change? Dr. Jayadevan, if I can get your opinion on that, 16 laboratories are dedicated for monkeypox right now, including 2 only for Kerala. Do you think more needs to be done, and maybe a strategic rethink is needed to make sure that we control the virus before it gets out of hand like the coronavirus pandemic did?
Yes, for every public health emergency, remember, public health emergency need not necessarily be a virus. It can be even, for example, a radioactive fallout. It basically means the entire world needs to sit up and pay attention and take certain actions. So that is basically what it means. And it is not a permanent thing. It can be changed, it can be revised after a few months, depending on the progress. So your question is, are we equipped? Clearly, the reason these cases are being picked up is because there is awareness. And awareness has to come on both parties. That is, healthcare providers, which are primarily doctors who are in general practice, and people who do venereal disease clinics, sexually transmitted disease clinics, and social workers who deal with patients in this genre. And also we should have an awareness among the general public, especially those who engage in high-risk behaviors. So if people don't wear their sexual history on their sleeve, it's impossible to tell, and it's their privacy. So people must be aware of this, and also the stigma and the pointing finger must not be a deterrent to people reporting these symptoms. Because if we start accusing people of all sorts of things when they come forward, that also may be a deterrent. So we must be very sensitive and be kind and courteous when it comes to matters like this. But I believe the government has taken assertive and clear steps in stepping up its diagnostic programs, as you rightly pointed out.
Right. So, Dr. Jayadevan, they're pointing out that the government's surveillance has been pretty good till now. But of course, awareness needs to be spread even more, as in the case of any other virus or any other disease spread. Now, if I can come back to you, Dr. Chand, on the basics of the monkeypox virus, really, now that it's spreading, how can you tell us how is the monkeypox spread? The routes of transmission different from COVID. Monkeypox spreads through respiratory contact like COVID, and even touch. What can you tell us about the sources of transmission of this virus?
Yeah, it can spread by the droplet, that is by mouth, nose, and it also spread by the skin contact. Anything which has an opening, or any cut or wound in the skin, and where your secretions of the vesicles get touched and it gets inside. So once it gets inside, this usually it's a period, first initial 1 to 3 days, you will have high fever, you will have headache, your lymph nodes will start swelling. So lymphadenopathy, headache, dizziness, and fever is what you present. Subsequently, what happens, these pox-like vesicles starts erupting, particularly on the face and the extremities, by the palm, sole, hand, less on the trunk. And some of them are like vesicles, they'll be like fluid-filled balls. Some of them will be pus-filled or white-colored balls. And if you have seen some of the pictures, it is little frightening. Okay, what we used to see in olden days with chickenpox and smallpox. So vesicles, pustules, they flood the body in the face and the hands, and that's when you are very, very infective. And over a period of time, 2 to 3, 4 weeks time, they slowly subside, they crust and come out. So that's the entire infective period. And if you are not careful within that period, yes, you may infect others. And one part, 3 to 6% of these smallpox can become very severe. You can get encephalitis, you can get bronchopneumonia, you can have a fatal mortality and a death if it is not taken care because of this zoonotic disease. It's basically a zoonotic because animal is the vehicle involved in the transmission.
Right, Dr. Chand, as you mentioned that the monkeypox virus in itself is not entirely fatal, but of course it can lead to other serious illnesses, and it can lead to serious illnesses for people who have a weakened immune system, and that's who can be most susceptible to serious illnesses and even a death due to the monkeypox virus. Now, Dr. Chand mentioned the symptoms and also the sources of transmission. If I can come to you, Dr. Jayadevan, now on what really can people do to keep themselves safe at this stage of the virus? What all are the steps that you think need to be urgently taken? If it's transmitted via droplets, does that mean our masks are also saving us through that route of transmission?
Yeah, the first thing for the public to know is that there is no need to be afraid or panic about a new global disease that is spreading dangerously for people. It is not at that level. But this is not to say that this is not important. What we know is around 15,000 cases reported, especially in Western nations. No deaths have occurred this year. And there have been 5 deaths reported from the African subcontinent as well. So the strain that is spreading outside of Africa is believed to be the West African strain, which is one of 2 strains of this virus, which is the milder strain. Now, that's not an invitation to get the disease, but as Dr. Ramesh said, it can cause severe complications, particularly if it causes encephalitis, pneumonia, or even an eye problem. Sometimes a lesion growing in the wrong organ, such as the eye, can cause severe complications. So we don't want to get into that. For the public, they can go about their regular routine activity with no fear at all. We've already shown an increase in our health behaviors. We keep better social distancing now. We wear masks in indoor areas where we are mingling with strangers. So all of these social distancing measures will help to some extent. But what is most important is to focus on people who engage in these behaviors. They must be aware that the person who they are in intimate contact with is not suffering from such an illness. And that is to look for skin problems and for people to also behave responsibly. If you're having symptoms, to not give it to other people as well. So the responsibility goes both ways.
Right. So you're saying that the current precautions that we're taking because of COVID are going to help with monkeypox as well. So you don't think that any new precautions need to be taken?
From a general public standpoint, no. But there are people who, for example, travel for entertainment purposes. So they may come into situations where you have close bodily contact with strangers. So they must be aware that they are setting themselves up for possible spread of such infections, and they could also spread it to their other partners as well. So which is why I mentioned people who are in this subgroup who are engaging in these behaviors must be warned and also must be cautious and be responsible.
Right. Thank you very much, doctors, for joining us. It is relieving to know that we shouldn't be alarmed as of yet, and the spread is not that alarming. And if we try to control it in time with the right precautions, with the right strategy, it could be controlled from becoming a widespread outbreak like the coronavirus pandemic did. And of course, as you said, the precautions that we're taking for COVID need to continue. Even though COVID cases had gone down, those precautions need to continue because they will help us fight monkeypox as well. And no new precautions are needed as of now. And of course, the disease is not really fatal, but of course, it can lead to further severe illnesses as the diseases that you pointed out. So that seems to be the idea that we're getting about the monkeypox spread in India. Thank you very much, doctors, for joining us on that discussion.